today's topic is nutritional deficiency and the skin changes. You have already taught in your PSM classes, that is community classes, community medicine classes, there are several nutritional deficiencies or vitamin deficiency and several changes in your skin and other systems of the body. But today we will discuss regarding the vitamin A deficiency, B complex deficiency, vitamin C and zinc deficiency, which is present in your syllabus, and different skin changes in the nutritional deficiencies. What is nutritional disease or what is nutritional deficiency disease? Nutritional disease is particularly common in the children and the infants, particularly the underdeveloped countries or developing countries. It is particularly common in the children in the underdeveloped tropical countries. Infants and the children are particularly at risk for the deficiency state, particularly the under 5 children are particularly at risk, especially the malnutrition. So, malnutrition particularly occurs in the children, but it can occur in the adult also. In developed countries, the most common cause of the malnutrition is the alcoholism or chronic alcoholism is the most important cause. Other causes which causes the nutritional deficiencies are, that is the postoperative patient, particularly after the gastrointestinal surgery, the psychiatric patient, particularly the anorexia nervosa, and the patient with the surgical and inflammatory bowel dysfunction. Say for the examples of the Crohn's disease and the ulcerative colitis, most commonly the Crohn's disease, and also bowel bypass surgery, cystic fibrosis, and the patients of the severe erosive oral mucosal disease like pemphigus vulgaris, which interferes with the eating and swallowing, leads to the deficiency of the several nutrients and the vitamin deficiency and mineral deficiency. So, in children, it is in malnutrition is the most common cause, that is the poor intake of the nutrition or poor intake of the food. In particularly in developed countries, the nutritional deficiency commonly found in the alcoholism, but it can be found in the other causes as I have already explained, that is in postoperative patient, in the patient of the total inflammatory bowel disease, that is the Crohn's disease or ulcerative colitis, or it can be found in the psychiatric patients too. Now coming to the vitamin A deficiency. Vitamin A deficiency is particularly common in the developing world in the children, particularly children are affected with the vitamin A deficiency. Vitamin A is required for the normal process of the keratinization of the mucous membrane. In the deficiency of the vitamin A leads to the abnormal keratinization, leading to the inflammation of the mucosal surface of the gastrointestinal tract and also the respiratory tract, leading to the diarrhea or pneumonia. So, vitamin A deficiency can produce to the diarrhea or the pneumonia. As you know, the vitamin rich foods, can you say some vitamin rich foods? What are the vitamin A rich foods? You have already taught in your PSM classes. What are the vitamin A rich foods? Yes, carotenoids, fish, vegetables, spinach, these are usually, and also some fish liver oils. These are usually vitamin rich foods. So, what are the clinical features of the vitamin A deficiency? Most important is the xerosis. Xerosis means the dry skin, the generalized dry skin, number 1. Number 2 is the follicular hyperkeratosis, which is also known as the phenoderma or the stored skin. How it looks like? It resembles the keratosis pilaris, that is a spiny follicular projection, mostly distributed over the anterolateral aspect of the thigh and the arms and the back of the elbow, produces the spiny follicular projection leading to the rough skin, which is also known as the phenoderma or stored skin. Apart from the vitamin A deficiency, it can be also found in other deficiencies like vitamin B, vitamin C, vitamin E or essential fatty acid deficiencies. In these cases, we can get this type of stored skin or phenoderma like skin, that is the keratosis pilaris, that is spiny follicular projection, mostly distributed over the anterolateral aspect of the thigh and the arms and the back of the elbows, produce the spiny follicular projection, which is very important findings which can be found in the vitamin A deficiency or essential fatty acid deficiency. Apart from the skin changes, what are the changes found in the vitamin A deficiency? That is the eye changes, that is the ophthalmic changes are the most important, which come from vitamin A deficiency. What are the ophthalmic changes? As I have already told you in your PSM classes, most important is the first, I think, there is a night blindness or nyctalopia. Night blindness patient কিভাবে প্রেজেন্ট করে? How it presents? রাতে বেলায় হোঁচট খায়, যেতে যেতে ছোট মানে হোঁচট খায়, ঠিক আছে তো? সহ্য করতে রাতের আলো দেখতে পায় না, রাত কানা হোঁচট খায়, ঠিক আছে? তারপর কি conjunctival xerosis, that means the dryness of the conjunctiva. Conjunctiva becomes the dry. Bitot spot. What is bitot spot? It is a triangular creamy spot present on the bulbar conjunctiva, apex directed towards the canthus. It is a sign of the severe vitamin A deficiency. Number 4 is the corneal xerosis, that means the dryness of the cornea. Keratomalacia. What is keratomalacia? Keratomalacia means the corneal ulceration, that means the ulceration of the cornea. And finally, if no intervention are taken, leading to the scar formation of cornea and complete blindness. So, vitamin A deficiency is a very important cause of blindness in the developing countries in where the children are not given any types of vitamin A immunization. So apart from the skin changes, eye changes are the most important thing. That is the night blindness, conjunctival xerosis, bitot spot, corneal xerosis and keratomalacia. These things are very important. You will be taught both in your viva and in your written exam. What are the eye changes are found, and bitot spot may come as a short note also. These are the most important thing. What are the eye changes? Number 1. So that is the night blindness or nyctalopia, conjunctival xerosis, bitot spot, corneal xerosis, keratomalacia or the corneal ulceration, corneal scar formation, and finally leading to the complete blindness. So treatment. What are the treatment? But nowadays the deficiencies are comparatively uncommon. Why uncommon? Because of the universal vitamin A immunization. Usually you know that from the 9 months to 5 years, 9 megadoses of the vitamin A immunization program is given, or the vitamin A oil are given in the 6 months apart. Usually 9 megadoses are usually given vitamin A. That's why these deficiencies are comparatively usually uncommon these days. So treatment. What are the treatment? The treatment is the oral vitamin A, 1 lakh international unit for 2 to 3 days, and followed by the recommended dietary requirement. In your PSM books, sometimes it is written that the treatment is slightly different. It is written in bitot spot, that is the, if the age of the children is more than 1 lakh, 2 lakh international unit stat and 2 lakh after 4 weeks, it can be given. So both can be given. In our book, it is written that 1 lakh international unit for 2 to 3 days and followed by the recommended dietary requirement. It can be also be written. Now coming to this is the picture of the phenoderma. As I already told, there is spiny follicular projection present over the back of the elbow. That is, the back of the elbows are involved with a spiny rough skin, produces the toad skin appearance. This is the phenoderma present on the back of the elbows. Now coming to the vitamin B complex deficiency. In the vitamin B complex deficiency, several B vitamins are present. That is the B1, B2, B3, B6, B12, biotin. These are usually the B complex vitamins. Most important is the B1 deficiency. That is first. That is B1 is also known as thiamine. Thiamine deficiency. The thiamine deficiency usually results in the beriberi. In the beriberi, the most important skin manifestations are the pale waxy edema. Pale waxy edema. Peripheral neuropathy can also occur. Apart from the edema, there is chance for peripheral neuropathy, and if not properly treated, there is a high risk of development of the congestive heart failure in the later life. There is high chance of development of the congestive heart failure, which can occur in the beriberi. The most important is the pale waxy edema, red burning tongue, and the peripheral neuropathy. Now coming to the vitamin B2 deficiency. What is the name of vitamin B2? Riboflavin. Yes, riboflavin deficiency. Riboflavin deficiency is most commonly found in the alcoholic patients, and also the phototherapy after the neonatal jaundice, hypothyroidism, and also it can be found in the chlorpromazine therapy. Long-term chlorpromazine therapy can also lead to the riboflavin deficiency. So what are the clinical manifestations of riboflavin deficiency? Most important is the angular cheilitis and the glossitis, that is parley key. Angular cheilitis and the glossitis is the most important. And the tongue is usually atrophic, that means the loss of papilla of the tongue, and it becomes the magenta in color. Magenta color tongue and the atrophic loss of, and usually the atrophic magenta color tongue is the most important clinical finding of the vitamin B2 deficiency. Apart from this, there is seborrheic like dermatitis, that is seborrheic dermatitis, most commonly found on the face, and also the follicular keratosis around the nares. Follicular keratosis is the most important finding. And also in the neglected cases, sometimes the severe deficiency, you can get the scrotal dermatitis, that is the eczematous changes present to the scrotum, which can extend up to the anterolateral aspect of the thigh and also the perianal areas extension. Number 2. And also it can be found in the balanitis and the phimosis. Balanitis and phimosis can also develop. What is balanitis? Balanitis means the inflammation of the glans penis. What is phimosis? Failure of the retraction of the pupils beyond corona glandis is known as phimosis. And also there is photophobia. Then the patient can't tolerate the bright light, photophobia, and also the blepharitis angularis or angular blepharitis can also occur. The most important thing you have to remember is the angular cheilitis and the glossitis, that is parley key, and also most important is the magenta color tongue or atrophic tongue. These two are most important. Angular cheilitis and the chelosis, the tongue is atrophic or magenta color. This you have to remember. This is the picture of the magenta color tongue and also the loss of papilla leading to the loss of papilla. Loss of papilla, usually atrophic tongue with magenta in color, is found in the riboflavin deficiency. Now coming to the vitamin B3. Vitamin B3 is also known as the, particularly it is a niacin deficiency. The niacin deficiency, you will get the pellagra. Pellagra may come as a short note also. So what is the pellagra? Pellagra usually found in the niacin deficiency, particularly deficiency of the nicotinic acid, or its precursor amino acid tryptophan, You know that the tryptophan, it can give rise to the producer of the vitamin B3 or the niacin. So particularly which type of diets are at risk for the deficiency of the vitamin B3? কি ধরনের ডায়েটে বেশি হয়? The people who are particularly dependent on the corn, millet, sorghum, this type of diets are particularly deficient in the niacin, leading to the pellagra. but pellagra can occur in the other vitamin deficiency also, particularly other B complex deficiency, particularly pyridoxal phosphate deficiency, and it can be found in the chronic alcoholism also. So, what are the causes of the pellagra? There are several causes of the pellagra. Most important is the dietary deficiency, particularly the patients who are dependent on the corn, millet, sorghum. And other causes are most important is the malnutrition and the vitamin deficiency, especially the pyridoxine deficiency. As I already told, along with the vitamin B3, vitamin B6 deficiency, or other B complex deficiency can also lead this type of condition. Chronic alcoholism. Chronic alcoholism can lead to the several vitamin deficiency, including the vitamin B3 deficiency. Carcinoid syndrome. Why carcinoid syndrome? Because carcinoid syndrome, the tryptophan is converted to produce the serotonin. It is not diverted to produce the niacin. So, most of the tryptophan is diverted to produce the serotonin. That is why in carcinoid syndrome, you will get the deficiency of the vitamin B3 and leading to pellagra. And also Hartnupp's disease. What you have already told the Hartnupp's disease. Hartnupp's disease, there is a deficiency of the enzyme tryptophan pyrrolase, leading to the impaired or malabsorption of the tryptophan, malabsorption of the tryptophan and essential amino acid, leading to the deficiency of the niacin. So, in Hartnupp's disease, there is defective malabsorption or defective absorption of the vitamin B3, leading to the deficiency of the niacin. Other disorder, that is the gastrointestinal disorder, say for example, gastrointestinal surgery, Crohn's disease can also produce this type of condition. Psychiatric condition, particularly anorexia nervosa, it is a particularly eating disorder. In this condition, there is high chance of development of several vitamin deficiencies and also deficiency of the niacins, and some medications also can give rise to the pellagra. Most important, some anti-tuberculous medication, that is isoniazid, pyrazinamide, ethionamide, proteonamide, azathioprine, 5-fluorouracil. This type of medication can also produce the niacin deficiency. So, you have to remember 3 or 4 most important. The most thing is the malnutrition, other vitamin deficiency, alcoholism, carcinoid syndrome, and the Hartnupp's disease and GI surgery. Just 3 or 4 enough. So, what are the clinical features of the pellagra? Pellagra patient কিভাবে present করে? Pellagra usually affecting not only the skin, it can affecting the gastrointestinal system and nervous system. What are the 3 Ds for pellagra? What are the 3 Ds? Yes. What are the 3 Ds? ডায়রিয়া, ডিমেনশিয়া আর আরেকটা ডার্মাটাইটিস, ঠিক লেখা আছে। ডায়রিয়া, 3 Ds, diarrhea, dementia and dermatitis. That means it can affecting the gastrointestinal tract, it can affecting the nervous system, and it can also affecting the cutaneous skin also. And what is the 4th D? 4th D key? If not properly developed, it is a fatal disease. Death can occur. Most important, death can also occur. Very good. You have to remember the 3 Ds, that is diarrhea, dementia and the dermatitis. So, how the skin lesion looks like? Because in pellagra, there is an intensely erythematous, scaly, phototoxic reactions are found mainly in the photoexposed part, that is the face, neck, and also the dorsum of the hand and also the dorsum of the feet. There is a clear-cut line of demarcation in the V area of the neck, which is known as the Cazal's necklace, and the recurrent and repeated phototoxic reaction leads to the, sometimes there is a burning sensation which can exacerbate in the summer or spring region, and recurrent and repeated exposure leading to the hyperpigmentation and scaling, and produces finally a coppery or mahogany in color. Copper or mahogany color skin can take place, and there is a clear-cut line of demarcation mainly found in the, this occurs because of the phototoxic reaction. This type of pellagra skin are more sensitive to the sunlight. So, there is an, as you look at the bilateral symmetrical distributed clay plug mainly developed in the sun exposed areas like face, V area of the chest, that is the V area of the chest produces a Cazal's necklace. This is mean for Cazal's necklace may come as a MCQ. Cazal's necklace, extensor aspect of the arm, back of the hand and dorsum of the feet, and due to the severe phototoxic reaction, severe and recurrent bouts of the phototoxic reaction, there is a scaling, thickening and the hyperpigmentation of the skin leading to produces the coppery or mahogany in color. Sometimes there is a vesicles may develop in the intense reaction, which is known as the wet pellagra, What is vesicle? Can somebody tell me what is vesicle? Vesicle is a fluid-filled skin lesion, size less than 0.5 centimeter. What is bulla? Bulla is the fluid-filled skin lesion, size more than 0.5 centimeter. So, in this case, in vesicles may develop in severe cases known as the wet pellagra, and there is also the other symptom, that is the weakness, severe weakness, anorexia, that means the loss of appetite, and some psychological problems, that is the depression, delusion of parasitosis, that is the insect crawling all over the body, psychological manifestation, hallucination, this can also take place in the pellagra, and also the gastrointestinal symptom, that means the diarrhea. The diarrhea, that means loss of fluids and electrolytes leading to the severe weakness. So, apart from the skin changes, you have to remember the anorexia and weakness, neuropsychiatric changes, that is anxiety, psychosis, burning sensation, dizziness, headache and delusion of parasitosis. This can also occur in pellagra, and also diarrhea, that means the loss of fluid and electrolytes. So, you have to remember some skin lesions, some neuropsychological problems weakness and GI problem. This can occur in the pellagra. So, pellagra affecting the not only skin, it affecting the gastrointestinal tract, it also affecting the neurological system. Clear? Now, how will you treat? First of all, the diagnosis. Diagnosis, the pellagra skin, first of the clinical diagnosis. It looks as the intensely erythematous clear-cut line, that is the photo-exposed part. With in chronic cases, you may develop the coppery or mahogany in color, and also there is sulfur flakes are found over the nose, the bright erythema of the nasal bridge, and the sulfur flakes are found. And there is also the patient weakness of the patient, history of diarrhea, history of psychological problems, and also the skin findings, his characteristics. Mostly clinical diagnosis. So, the treatment, how will you treat? Diet mostly rich in the vitamin B3, that is the egg, meat, milk and vegetables, and supplementation with the nicotinic acid, that is 100 mg 3 times daily for the several weeks, lead to the reversal of the pigmentation. 100 mg 3 times daily for several weeks. And in case of the fluid and electrolyte depletion, you have to give the fluid and electrolyte suppression, that is ORS, or sometimes the IV fluid can be given to for the treatment of diarrhea. So, you have to diagnose it correctly and also for the treatment. Not only you have to replace the vitamin B3 or niacin, but you have to treat the other conditions also, that is the psychological problems, or if the diarrhea is present, proper fluid and electrolyte corrections should be done. This is the picture of the pellagra. You see there is also scaly erythematous lesion with a clear-cut line of demarcation, which is known as the Cazal's necklace, and the long-standing cases, as I have already told, there is a coppery color skin or mahogany color skin, which is very important, only is found in the photo-exposed part. That is a very important finding of the pellagra. This is known as the Cazal's necklace. This is known as Cazal's necklace. মনে থাকবে তো? এটা কিন্তু অনেক MCQ দেয় কোন ভিটামিনের ডেফিসিয়েন্সি তো হয়। Now coming to the vitamin B6 deficiency. Vitamin B6 is also known as কি বলে vitamin B6 কে? Pyridoxal phosphate. So, vitamin B6 deficiency is mostly found in the cirrhosis of the liver, that means chronic liver disease, also uremia, and some medication like isoniazid. Isoniazid is given the treatment of, kisa treatment of the isoniazid? Tuberculosis. In the long-standing isoniazid therapy, there is also deficiency of the vitamin B6 or pyridoxal deficiency. ওই জন্য tuberculosis treatment দেখবে সবসময় একটা B complex vitamin সবসময় দেওয়া হয় একটা, ঠিক আছে? So, what are the clinical features? First of all, the seborrheic dermatitis like eruption, that means the eruption which looks like seborrhea, that means the distribution over the eyebrow, side of the nose, back of the ear, there is a scaly lesion which looks like seborrheic dermatitis like eruption. Number 2 is again the ectopic glossitis and ulceration. There is loss of papilla, ectopic glossitis and ulceration of the tongue is the most important. Painful sensory neuropathy. Sensory neuropathy is very important finding of the vitamin B6 deficiency. There is pellagra-like dermatitis, as I have already told. And apart from the niacin, there is other vitamins can causes the pellagra-like symptom. Most important is the pyridoxal phosphates, and also there is neurological symptom, that is confusion, somnolence can occur. So, you have to remember the most important thing, that is the ectopic glossitis, ulceration, seborrheic-like dermatitis and pellagra-like dermatitis, and sensory neuropathy. Sensory neuropathy is very common in vitamin B6 deficiency. So, vitamin B6 deficiency produces the apart from the skin changes, there is also the sensory neuropathy can also occur. Now, the vitamin B12 deficiency. Vitamin B12 is also known as cyanocobalamin deficiency. So, particularly vitamin B12 is absorbed from the terminal ileum with the help of the intrinsic factor in the acidic environment. So, vitamin B12 deficiency occur particularly in case of terminal ileal disease or resection of terminal ileum or intrinsic factor deficiency, or if there is an acidic environment or acidic milieu is disturbed, that means in the achlorhydria. Particularly, you will get the vitamin B12 deficiency. So, the vitamin B12 deficiency is mostly found in gastrointestinal deficiency of the intrinsic factor, I already told, because it helps in the absorption of the vitamin B12, intrinsic factor, achlorhydria, where the acid production or hydrochloride acid production is totally disturbed, and also the terminal ileal disease or the resection of the terminal ileum, malabsorption syndrome, and also the long-term metformin therapy. What is metformin? Metformin is a drug, oral hypoglycemic drug, particularly given for the treatment of type 2 diabetes. Even in the long-term metformin therapy, there will be vitamin B12 deficiency, that is cyanocobalamin deficiency. So, what are the features of the vitamin B12 deficiency? Most important is the generalized hyperpigmentation. This is the most important thing. Generalized hyperpigmentation. The pigmentation mostly occurs in the photo-exposed part. That means face, the dorsum of the hands, the palmar creases, and knuckles, and also the nail pigmentation. Nail pigmentation can also occur. Mainly photo-exposed part. That means face, dorsum of the head, palmar creases, and the nail. So, generalized hyperpigmentation is very important characteristic finding for the vitamin B12 deficiency. Apart from that, there is also atrophy of the papilla of the tongue and usually beefy red tongue. Vitamin B2 deficiency, you get the magenta tongue, but in this case, you will get the beefy red color tongue, and also the premature graying of hair or premature caninitis. So the premature caninitis can occur lots of problems, but the vitamin B12 deficiency is a very important cause of premature caninitis or premature graying of hair, most important thing. And also there will be megaloblastic anemia. Along with vitamin B12, folic acid can also produce the folic acid deficiency can also produce the megaloblastic anemia and neurological problem, that is the ataxia, that is the incoordination of the gait, poor muscle incoordination, and also you will get the paresthesia and mental status changes, which is found in the vitamin B12 deficiency. So most important is the generalized hyperpigmentation, mainly the photoexposed part, along with the atrophic glossitis with beefy red tongue, premature caninitis, and some neurological problem, that is the ataxia, confusion, and megaloblastic anemia. So most important you have to remember mainly, that is the most generalized hyperpigmentation, premature graying of hair, neurological problem, ataxia, and also loss of papilla of the tongue and beefy red color tongue. The deficiency is usually treatment. What is the treatment? Usually parenteral replacement. High dose of vitamin B12 is given. The parenteral IM injection of the 1 milligram per week for 1 month, then 1 milligram per month. Usually vitamin B12 are given. It leads to the reversal of the pigmentation, but the neurological symptom may or may not respond. Neurological response now korte pare, ঠিক আছে, কিন্তু pigmentation response করে যায়. There is a improvement of the pigmentation of the skin, mucous membrane, and also the nail pigmentation can reverse. Now coming to the biotin deficiency. Biotin is also known as the vitamin B7. Biotin deficiency. So biotin deficiency is comparatively uncommon, but it can produce, because it is mainly produced by the intestinal bacteria, and the deficiency occurs in the patient with the malabsorption syndrome or the short gut. It is particularly found in the malabsorption syndrome or the short gut, but deficiency is still not so common. The clinical feature, again the skin and nervous systems are most commonly affected, and biotin deficiency is similar to zinc or essential fatty acid deficiency, that is the periorificial erosive dermatitis, which is usually erosion of the mucosa or the red in color, and also you will get some neurological problem, that is the confusion, psychosis, and also there will be alopecia. Alopecia is very important for the biotin deficiency. Alopecia may be diffuse or total alopecia, or sometimes there is a loss of eyelash and eyebrow can occur in biotin deficiency. And also there is xerosis. Xerosis can also occur, as you have already told, that is the dry rough skin, and most important thing is the alopecia. Alopecia, as I already told, there may be total alopecia or loss of eyelash or eyebrow can occur in the biotin deficiency. So it should be replaced by the 10 milligram of the biotin per day, but sometimes you have to look for the other deficiency, whether zinc deficiency or essential fatty acid deficiency present or not, number one. And number vitamin C deficiency. Now coming to the vitamin C deficiency. Vitamin C is also known as ascorbic acid. Vitamin C deficiency produces scurvy. Scurvy may come as a short note also. Scurvy short note die. So what are the findings of the vitamin C deficiency? Usually in vitamin C deficiency, kader hoy vitamin C deficiency. Vitamin C deficiency is mostly found in the chronic alcoholics. Chronic alcoholics the motamoto somosto vitamin deficiency, C vitamin deficiency also common, and also smoking is a risk factor. Smoking is a risk factor for the vitamin C deficiency. So it can be found in the other conditions also, like psychiatric patient in the restrictive diet, particularly anorexia nervosa, and the psychiatric patient, you will get the vitamin C deficiency. In the vitamin C deficiency, you have to remember the 4H. You have to remember the 4H. In vitamin C deficiency, you have to remember the 4H. 4H. What are the 4H? That is hyperkeratosis of the hair follicle, hyperkeratosis of the hair follicle, hyperkeratosis of the hair follicle, and cause to hair. Number 2 is the hemorrhagic sign. What are the hemorrhagic signs? Most important is the perifollicular hemorrhage. Even the ecchymosis can occur. Ecchymosis, charana coin bleeding spot, can occur in the lower extremities. And also there is intramuscular hemorrhage, subperiosteal hemorrhage. Subperiosteal hemorrhage leading to the inability to move the limb, leading to pseudoparalysis in the children. বাচ্চারা অনেক সময় limb move করতে difficulties হতে পারে. And most important is the perifollicular hemorrhage. There may be intramuscular hemorrhage, bleeding from the gum, and subperiosteal hemorrhage. Subperiosteal hemorrhage produces the pseudoparalysis in the children. Number 3 is the hypochondriasis. That is the health related anxiety problem. And number 4 is the hematological manifestation. Anemia. Why anemia occur? Because of the loss of blood from the body and also the loss of blood from the gingiva and other sides. There is high chance of development of the anemia due to blood loss. Patient have complaining of the weakness and other symptoms. So most important, you have to remember the 4H for scurvy. 4H. Most important, the hyperkeratosis of the hair follicle and corkscrew hair, that is the hair become coiled separate hair. There is hemorrhagic manifestation. Most important is the perifollicular hemorrhage. Hemorrhage can also found in the lower extremities, that is ecchymosis, and there may be the subperiosteal hemorrhage, subcutaneous hemorrhage, and subperiosteal hemorrhage leading to the difficult inability to move the limb, leading to the pseudoparalysis, also from the bleeding from the gums and bleeding from the other sides. Hypochondriasis, that is the health related anxiety problem, and hematological manifestation, most important is the anemia, that is due to the blood loss. You have to remember just 4H. Okay. So, in vitamin C deficiency, there is, as I have already, hyperkeratosis of hair follicle and corkscrew hair. Perifollicular hemorrhage is very characteristic, that is hair follicle around the hemorrhage around the hair follicles. Ecchymosis, particularly found in the lower extremities. Ecchymosis, particularly found in the lower extremities. Subperiosteal hemorrhage leading to inability to move the limbs. And other findings, that is the hemorrhagic gingivitis. This is most important. In scurvy, you will get the gingivitis. Hemorrhagic gingivitis, recurrent and repeated hemorrhagic gingivitis leads to the loosening of the teeth, and also the loss of teeth can occur, and also delayed wound healing. Delayed wound healing and anemia, weakness and fatigue. Why? Because of the loss of blood from the other side. So, there is the anemia, weakness and fatigue. So, you have to remember the 4H, that is for the scurvy. So, how will you treat? What is the point of diagnosis? Diagnosis mainly by the clinical diagnosis. If you will get, see, that is the perifollicular hemorrhage, corkscrew of a torch, corkscrew hair, and there is bleeding manifestation, that is subperiosteal, that is particularly the perifollicular hemorrhage, or the gum manifestation, particularly the hemorrhagic gingivitis, or the loss of tooth, there is a high chance of development of the scurvy, number 1. So, and also there is low vitamin C level, and it is usually corrected by the vitamin C. If you treated with vitamin C, the condition rapidly responses. Most important, that is the vitamin C, usually given 1000 milligram day for few days to 1 week, and maintenance days of the 100 milligram per day with vitamin rich foods are given. What are the vitamin C rich foods? Mainly fruits, that is the guava, amla, and also some fruits and vegetables. You have to replace it with the vitamin C rich food. So, in scurvy, you have to remember just 2 or 3 points. It is particularly common in the chronic alcoholics and particularly smokers and psychiatric patients, but it can occur in the other dietary deficiency. Most important, you have to remember the clinical feature 4H, that is hyperkeratosis of the hair follicle and corkscrew shaped hair, perifollicular hemorrhage, that is hemorrhagic sign, and also hemorrhage can occur from the other side, that is the ecchymosis of the lower extremities, that is the subperiosteal hemorrhage leading to the inability to move the limb and pseudoparalysis, that is hypochondriasis, that is the health related anxiety problem, and hemorrhagic sign, that is and recurrent and repeated hemorrhage leading to the anemia, weakness, and also you have to remember the anemia, weakness and fatigue. And treatment with the replacement of the ascorbic acid, usually 1000 milligram per day for few days to 1 week, and then 100 milligram day as a under maintenance therapy. This is a very important picture of the corkscrew hair, that is the corkscrew hair, tortuous corkscrew hair with perifollicular hemorrhage. Perifollicular hemorrhage, you can see the perifollicular hemorrhage and corkscrew hair. And in the gingivitis, particularly hemorrhagic gingivitis, you can see there is hemorrhage, a recurrent and repeated attack of the hemorrhagic gingivitis, and there is loss of tooth also. This is a very important clinical manifestation for the vitamin C deficiency, scurvy. Now coming to the zinc deficiency. So, zinc deficiency is very important. So what are the conditions can give rise to the zinc deficiency? So, zinc deficiency may be inherited deficiency or acquired deficiency. Inherited deficiency is known as the acrodermatitis enteropathica. What is it? Acrodermatitis enteropathica is an autosomal recessive condition in which there is a mutation of the gene SLC39A4 gene, which usually codes the zinc transporter protein ZIP4, leading to the zinc deficiency. There is a congenital deficiency, number 1, acrodermatitis enteropathica. And number 2 is the acquired deficiency. Acquired deficiency can occur in the lots of conditions. Most important is the, as I already told, the chronic alcoholism after gastric bypass surgery or GI surgery, or it can be found in poor nutritional intake, and also it can be found in the inflammatory bowel disease, particularly ulcerative colitis or Crohn's disease. It can be found, the chronic zinc deficiency. So, and particularly premature infants are at risk because of the low body zinc store. Due to low body zinc store, premature infants are at risk. And also you can find the zinc deficiency during the time of the complementary feeding. In the first 6 months, there is exclusive breastfeeding, and after the complementary breastfeeding, when there is a requirement is high, there is a chance of, during the time of weaning, there is a high chance of zinc deficiency. So, what is the clinical manifestation of the zinc deficiency? How it presents? Kivabe present kore? Most important is the acral and periorificial pustulobulous dermatitis. Acral or periorificial. Periorificial means that around the oral cavity, around the groin or genitalia, there is an erosion and pustulobulous lesion with erosion with a red erosive lesion. Number one. Number two is the recurrent and repeated diarrhea. If you can see in an infant with recurrent and repeated diarrhea with pustulobulous, acral or periorificial dermatitis, there is a high chance of zinc deficiency. Please remember it. Number two is the angular cheilitis with glossitis. Angular cheilitis with glossitis and burning mouth syndrome. Then burning mouth, apart from the zinc, other vitamin B complex deficiency can also produce the burning mouth syndrome. So zinc deficiency can produce the burning mouth syndrome with angular cheilitis and glossitis. Pustular paronychia, that means the nail involvement. Pustular paronychia with nail dystrophy with thinning of nail. Pustular paronychia with thinning of nail and nail dystrophy can also occur. Number one. And also the loss of appetite, hypogeusia. Hypogeusia meaning, what is the meaning of hypogeusia? Diminished taste sensation. Diminished taste sensation. Taste sensation, diminished taste sensation. And also there is diarrhea and growth retardation. Recurrent and repeated diarrhea leading to failure to thrive and growth retardation. And also neuropsychiatric manifestations or neuropsychiatric changes can also occur, particularly that is the depression, low mood you can found, and chronic lesion. These are the usual in chronic lesion, particularly found in the adult after the gastrointestinal surgery. Chronic lesion is usually psoriasis form. That means the chronic lesions are usually psoriasis like clear-cut hip-top lesion, psoriasiform dermatitis are commonly found in the chronic lesion. So most important is the acral or periorificial pustulobulous dermatitis, bullous or pustular lesion with erosion of the mucosa and also recurrent and repeated attack of diarrhea, angular cheilitis and glossitis with burning mouth syndrome and psychological problems. These are most important things. And loss of taste sensation, anorexia, these are important things. Diagnosis, how to diagnose the zinc deficiency? Most important thing is the clinical findings. That is the erosive or pustulobulous acral or periorificial dermatitis with the erosion of the mucosa, and particularly age group, as already told, you can found either in the small children, particularly after during the complementary feeding, or adult patient. And also the diagnosis of the low serum zinc level and the low serum alkaline phosphatase level. Why alkaline phosphatase level? Because the alkaline phosphatase is a zinc dependent enzyme. Apart from the low serum level, you will get the low serum alkaline phosphatase. Sometimes zinc level may be normal. Alkaline, the first you will get the low serum alkaline phosphatase level. But the most important thing to remember is that in case of chronic diaper rash, if the patient comes with the small children coming with the chronic diaper rash with diarrhea in an infant, should be evaluated for the zinc deficiency. Chronic diaper rash with diarrhea. If you get the chronic diaper rash, particularly with diarrhea, in that case you have to always think for the zinc deficiency. Number one. So treatment. How it is treated? Supplementation with zinc sulfate. Usually zinc sulfates are given 1 to 2 milligram per kg body weight for the several weeks, particularly in case of acquired deficiency. But in case of the congenital deficiency or inherited deficiency, in case of acrodermatitis enteropathica, it is given in comparatively high dose, that is 3 milligram per kg body weight per day for lifelong supplementation should be given. This thing you have to remember. But acrodermatitis enteropathica, usually the higher dose of the zinc supplementation should be given. This is a picture of the acrodermatitis enteropathica, the small children, that is the periorificial dermatitis. Here the erosion of the mucosa, you will see, and also the involvement of genitalia and the groin. Sometimes there is a history of diarrhea and the recurrent periorificial pustulobulous dermatitis. Superadded candidiasis may develop. In this lesion, you may found the superadded candidiasis. Sometimes the superadded candida lesion can also occur. This is a very important picture of the acrodermatitis enteropathica. As I have already told, it is an inherited condition, but it occurred due to the autosomal recessive cause, occurred due to the mutation of the gene, and which particularly responsible for the zinc transporter protein ZIP4. So it is a case of acrodermatitis enteropathica. It is particularly found in the zinc deficiency. So in this class, you have to just remember the few points. Summarizing. First of all, the vitamin A deficiency. Vitamin A deficiency, you will get the skin changes plus eye changes. Number one, you will get the xerosis, phenoderma or toad skin, that is the spiny follicular lesion, most commonly found in the anterolateral aspect of the thigh and the arm and back of elbow, and xerotic of xerosis, and apart from the eye changes. What are the eye changes? Night blindness, conjunctival xerosis, bitter spot, corneal xerosis, keratomalacia, and blindness, if not total intervention is taken. Number one. Number two is the B complex deficiency. B complex deficiency অনেক আছে, তাহলে মনে রাখবো কি করে? Particularly vitamin B1 deficiency very mostly produces skin manifestation খুবই কম, particularly pale waxy edema, and also there is burning tongue and peripheral neuropathy. Peripheral neuropathy is the mostly found in the alcoholics. Vitamin B2 deficiency, there is angular cheilitis or glossitis. Parleki is most important. And apart from this, there is loss of papilla of the tongue and magenta color tongue, particularly found in riboflavin deficiency. Already told you. And B3 deficiency produces the pellagra. Pellagra is characterized by 3D, diarrhea, dementia, dermatitis. Already told, that is the erythematous scaly lesion with an intense phototoxic reaction along with the neuropsychological problems and GI problem, that is diarrhea. You have to remember just 3D, diarrhea, dementia, dermatitis, and if not proper intervention taken, it is fatal disease, even death can occur. This is a very important thing. Now, B6 deficiency produces the pyridoxal phosphate. It produces the painful sensory neuropathy, or it can produce the, that is the tongue problem. Again, tongue problem, that is the glossitis. Tongue problem can have seborrheic like dermatitis. Vitamin B12 deficiency usually produces the generalized pigmentation, mainly photoexposed part, that is the facial pigmentation, pigmentation over the knuckle, palmar crease, and the nail pigmentation. And also you will get the peripheral neuropathy. Ataxia. Ataxia is a very important finding of the, with the neurological sign, premature graying of hair with megaloblastic anemia in case of B12 deficiency particularly. And there also you have to get the biotin deficiency. Biotin deficiency particularly you will get the skin and psychological problem, that is the periorificial dermatitis, just like zinc deficiency. And also there is a diffuse loss of hair, that is alopecia, xerosis, and neuropsychological problems are common. And vitamin C deficiency, scurvy, it is scurvy short note there. Scurvy particularly produces the 4H, as mentioned, 4H, that is the hyperkeratosis of the hair follicle which causes to hair, hemorrhagic sign, mostly the hemorrhage, perifollicular hemorrhage, ecchymosis, bleeding from the gum, subperiosteal hemorrhage, and hemorrhage from the muscles, intramuscular hemorrhage, subcutaneous hemorrhage can occur, hypochondriasis, and hematological manifestation, anemia and weakness. These are most important finding of the vitamin C or deficiency or ascorbic acid deficiency, number 1. And lastly, the zinc deficiency. And the zinc deficiency অনেক সময় শর্ট নোট আসতে পারে বা ক্লিনিক কেসের জন্য খুব ইম্পর্টেন্ট পেডিয়াট্রিক ডিপার্টমেন্টে, particularly found in the 2 types of cases, as the small children or infant during the time low body zinc store, or during the time of weaning or complementary feeding. There will be acral or periorificial pustulobulous dermatitis with erosion of the mucosa, and also there is superadded candidiasis and history of the recurrent and repeated diarrhea, angular cheilitis, glossitis with burning mouth syndrome, and also you will get the loss of taste sensation, anorexia, and also depression, low moods. These are also can be found, and due to diarrhea there is failure to gain weight, that is failure to thrive. These are found in the particularly zinc deficiency. So you have to remember this type of manner, the zinc deficiency কি হতে পারে, ঠিক আছে এগুলো। তো এখান থেকে বেশ কতগুলো বেশ তোমাদের কিছু শর্ট নোট দেয়, যেমন বিটর স্পট অনেক সময় শর্ট নোট দেয়, ভিটামিন এ ডেফিসিয়েন্সি, স্কারভি, পেলেগ্রা, এগুলো অনেক সময় শর্ট নোট দেয়, ঠিক আছে। এগুলো মোটামুটি জিজ্ঞেস করো অনেক সময়, এটাই ব্যাস।